In this final part of Chapter 12, we're going to discuss spinal injuries. In Part 1 and 2, we've already discussed head injuries and parts of the face, such as the eyes, nose, and mouth. With spinal injuries, the spine is a column of vertebrae, and it consists of nerves that join the brain to other parts of the body and the organs, etc. If a broken vertebrae pinches some of the spinal nerves, you can end up paralyzed, which obviously is a very serious injury. So you can suspect spinal injury whenever there's significant cause of injury. People that are unresponsive should be treated as though they have a spinal injury. And spinal injuries can occur mainly from motor vehicle crashes, falls, violence, and even sports. So what to look for: back pain, leg numbness or tingling, tenderness and pain when you run the fingers down the spine, failure of feeling that when you do tests to test somebody's sensation or movement, if they don't, for instance, you tickle the bottom of their feet and they don't feel it or move their toes, then you know that there might be some spinal injury that has occurred. Call 911, don't move the person, apply some type of spinal stabilization and prevent heat loss. And you want to look for, see if the person is alert, try talking to them, see if there's any neck pain or neurological symptoms. Are they able to move their fingers and toes? And treat other injuries if there are any other injuries that you see. Look for altered mental status. Are they intoxicated, confused? And assume that a spinal injury exists and stabilize the person, especially if you're not sure. It's always better to assume that they have a spinal injury, because you don't want to move a person that has had a spinal injury, and even if you're not aware of it, you think it may not be one, but it turns out that it is, you could injure them permanently. So with spinal injuries, you have to be very, very careful. Again, assess the situation, look for other signs, symptoms, injuries, and when in doubt, always treat the person as if they have a spinal injury. Stabilize the spine, call 911, and make sure you keep the patient warm until EMS arrives. So that's it for Chapter 12 on the head and spinal injuries. Again, there are so many that can occur. This is just a brief overview of the chapters. These videos are just very, very quick outlines. You really need to be reading the full presentations that are in the learning modules each week, and also reading your chapters. And again, most of the time when we were trying to do anything in first aid, as far as learning, the best way to learn is by doing. So if you can practice some of these scenarios on your own with any of the chapters, and taking the information that you're learning and apply it with somebody that could be your test model, so to speak, that would help hone your skills even better.